Men over 50, have you noticed your erections aren't as strong or reliable as they once were? Most guys blame low testosterone or poor circulation, but here's the surprising truth. The real problem is often a group of muscles you've probably never trained in your entire life. These muscles decide whether blood stays locked inside your penis or leaks out too soon. And just like your arms or legs, if you don't use them, they weaken with age. Today, I'm going to show you 5 powerful stretches and exercises that awaken these hidden muscles, restore firmness, and even improve bladder control. Stick with me, because the last move I'll reveal is the one most men skip, and it could be the key to bringing back the strength and control you thought was gone forever. Here's something most men don't realize. Your pelvic floor is just like any other muscle in your body. If you train it, it grows stronger. If you ignore it, it weakens. And the first signs usually show up in the bedroom. Think of your pelvic floor as a hidden support system. It's a sling of muscles that sits at the base of your pelvis. And it has 3 big jobs. It supports your bladder, controls urination, and this is the part most men never hear about. It's the muscle group that locks blood inside the penis during an erection. When you're younger, you don't even notice this system working. But by your 50s, 60s, and beyond, years of sitting, stress, and muscle loss take their toll. These muscles get weaker. The result? Blood doesn't stay trapped inside as effectively. Erections become softer, shorter, and less reliable. Here's the good news, this isn't permanent. You can actually retrain these muscles. In my clinic, I've seen men in their late 50s, even 70s, rebuild their firmness simply by practicing the right stretches and strengthening moves. Some even notice fewer bathroom trips at night, less pelvic tension, and better posture. So before you ever think about expensive pills or risky procedures, start here. Strengthen the foundation, because once your pelvic floor wakes up, everything else, blood flow, control, confidence, improves naturally. All right, let's start with the foundation, the pelvic tilt. It may look simple, but don't let that fool you. This one move can completely change the way your pelvic floor responds when you need it most. Here's how you do it. Lie down comfortably on your back. Bend your knees about 45 degrees, feet flat on the floor, hip width apart. Let your arms rest by your sides, palms down. Now take a deep breath in. As you exhale, gently press your lower back into the floor, almost like you're ironing out the space beneath it. At the same time, imagine pulling your belly button in toward your spine. That slight tilt in your pelvis, that's the key. You should feel your lower abs and deep pelvic muscles tighten. Hold that contraction for 3 to 5 seconds. Steady breathing, no straining, then slowly relax back to the starting position. When you first try this, it might feel strange, almost like you're discovering a muscle you didn't know existed. And that's exactly the point. This movement connects your abs and your pelvic floor, training them to work together. In the medical world, we call it co-contraction, but you'll feel it as control, stability, and strength. Start with 10 to 15 reps a day. Focus on slow, perfect form. Over time, you can build up to 20 or even 25. The goal isn't speed, it's precision. Think of it as teaching your body a new language. At first, it takes effort, but soon it becomes second nature. Here's the payoff. Men who stick with this exercise often describe a moment where they realize, wait, I'm locking in firmness, not losing it. That shift alone can restore confidence you thought was gone for good. Now that you've activated your pelvic floor with the pelvic tilt, let's add flexibility and deeper control with the prone stretch. This one looks almost too easy, but inside your body, it's doing something powerful. Here's how to set it up. Lie face down on a comfortable mat or carpet. Slide your elbows under your shoulders so your chest lifts slightly. almost like you're reading a book on the floor. Keep your forearms flat, parallel, and your neck relaxed, eyes looking gently forward. From this position, draw your belly button inward, as if you're trying to create a little space between your stomach and the floor. At the same time, lightly contract your pelvic floor. Imagine you're trying to stop urine mid-flow. Hold this for 20 to 30 seconds. Breathe slowly and steadily. Then relax and repeat 3 to 4 times. Over time, work up to holding for 45 seconds or even a full minute. Why is this stretch so effective? Because it's not just about strength, it's about balance. Sitting for decades tightens the front of your body, your hips, your abs, even your posture. The prone stretch lengthens those tight muscles while teaching your pelvic floor and core to contract in harmony. The benefits go way beyond the bedroom. Many men notice less tension in their lower back, better posture, and a new sense of connection to their pelvic muscles. And when intimacy comes, that connection means your brain and body communicate faster and stronger, like upgrading from dial-up to high-speed internet. Next up is the kneeling ab draw-in. At first glance, this one barely looks like an exercise, but don't be fooled. It's a quiet powerhouse for building control and endurance where it matters most. Here's how to do it. Start on all fours in what yoga calls the tabletop position. Place your hands directly under your shoulders, knees under your hips, and keep your spine neutral, not sagging, not arched. Spread your fingers wide for stability and let your neck stay relaxed, eyes looking down. Now here's the move. Slowly exhale through your mouth. As you exhale, gently pull your belly button inward, flattening your stomach, like you're zipping up a snug jacket. At the same time, lightly contract your pelvic floor. Imagine you're lifting the muscles inside your pelvis upward or stopping urine midstream. Hold that contraction for 3 to 5 seconds. Keep breathing. Don't tense your shoulders or hold your breath. Then slowly relax and return to the starting position. Do 10 to 15 reps. Over time, build up to holding each contraction for 7 to 10 seconds. You can even experiment with shifting your weight slightly forward or backward to challenge different muscle fibers. So why does this exercise matter? Because it links breath, core, and pelvic floor into one movement. It's like teaching your body to coordinate an orchestra instead of playing instruments out of sync. The result is stability, endurance, and fine-tuned control. Now we move to one of the most powerful moves in the entire routine, the bridge abduction. This exercise doesn't just target the pelvic floor, it brings in your glutes, hips, and core, creating a complete support system for stronger erections and better stability. Here's how you do it. Lie flat on your back on a comfortable surface. Bend your knees about 90 degrees, feet flat on the floor, hip width apart. Place your arms by your sides, palms pressing gently into the ground. Now press through your heels and lift your hips toward the ceiling. You should form a straight line from your shoulders to your knees. That's your bridge position. Once you're up, here's the key. Gently push your knees outward, as if you're trying to stretch a resistance band, even if you don't have one. Hold for 2 to 3 seconds. Then bring your knees back to center with control. Start with 8 to 10 repetitions, focusing on smooth, steady movement. As you grow stronger, aim for 15 to 20 reps, or add a resistance band around your thighs for extra challenge. Why does this work so well? Because it's a triple threat. Pelvic floor muscles lock in blood flow. Glutes, and the largest, most powerful muscles in your body, support pelvic stability and circulation. Hip stabilizers keep everything aligned so blood can flow freely where you need it most. Finally, we come to the move that most men skip, but it might just be the most powerful of them all. It's called the rocking frog stretch. At first, it looks unusual, but the way it opens, stretches, and activates your pelvic region can completely change the way blood flows and stays locked in. Here's how to do it. Start on all fours on a padded surface or yoga mat. Slowly slide your knees out wide, forming a V shape with your legs. Keep your feet turned outwards so your inner thighs face the floor. Lower down onto your forearms, keeping your back neutral and your head relaxed. Right away, you'll feel a deep stretch through your inner thighs, groin, and hips. Breathe into that. Once you're steady, begin rocking your hips gently forward and back. Slow, controlled, almost like a wave moving through your pelvis. Stay here for 30 to 40 seconds, then rest for 20 to 30 seconds and repeat up to 3 times. As your flexibility improves, this stretch will feel more natural and even enjoyable. So there you have it, the 5 best stretches and exercises to restore stronger, more reliable erections after 50. The beauty of this routine is its simplicity. No pills, no machines, no risky side effects, just 5 to 10 minutes a day, less time than you spend brushing your teeth or checking your phone, can unlock dramatic results. And remember, this isn't just about intimacy. These exercises improve your bladder health, reduce back pain, support posture, and even boost your overall vitality. They remind you that your body is still capable of growth, strength, and renewal, no matter your age. If you're in your 50s, 60s, even 70s, it's never too late. Start today, commit to these 5 moves, and watch how your strength, your control, and your confidence return step by step.